Hello everyone, I hope everyone is fine, that we are just few hours heading to our survey inshallah. We are sharing last minute checklists for everyone in the hospital just to make sure that everything is ready in your unit or your department. Uh, be confident, we are so confident, and we are so confident that because of you we'll pass the survey in very good shape. And just make sure that you're not giving the surveyors any unnecessary chance to put a finding or a recommendation or a comment in your department or unit. So this last minute checklist, it will help you just to make sure just to check everything in your unit and to avoid these unnecessary findings. Related to the environmental things to be checked in your department, like we have to make sure there is no food or drinks even packed in any patient care areas, no tea, no coffee, nothing packed in these areas. That you have to make sure that there is no equipment or objects blocking the hallways or any passages in your hospital. And you have to make sure like nothing out of service also blocking anything in your units. The fire exits, the fire doors should be clear, nothing should block it. Linen carts, waste bins should be covered, like even the make sure the housekeeping trolley is also covered in your unit. Make sure there is nothing stored on the ground. Make sure there is no expired medications or materials in your units, in your crush cart, in anywhere in your medication rooms. All these areas you have to make sure about it. Even if you're storing anything in a box and just if you have like a big quantity in one box of any kind of materials, if you're keeping it in small boxes just to store it there or something, just make sure there is no expiry date on that, and you have to label it properly. And of course that anything about like the antibiotics, about like any that multiple dose vials or something, that you have to make sure the opening date and expiry date is mentioned, or at least the expiry date should be there. So all medication oxygen cylinders are secure. This is very important. Related to us, like, or related to everyone or staff members, you have to make sure that you're coming with your ID card. You have to make sure you're answering only the questions they ask. Don't give unnecessary or don't give extra information, because whatever extra information you will give, it may make them ask for these areas or to ask about other sides of these information you already given, and this will not help you and will not help your colleagues. Okay, they are coming to ask about few standards, and we have to answer them regarding these standards, and this will help you. This is not an inspection, this is an accreditation survey. They want to make sure you have policies, you have procedures, forms, you have a system to manage your hospital, your unit and department. Okay, so you have to help each other to respond to the question. We'll mention this in the last slide, that about like how to, if my colleague is saying something wrong, so in this situation, like, you should not cut him, you not should cut his talk or speech. You have always to wait once like he will take his breath or her breath like in between. So you have to add like, I would like to add to my colleague. Okay, don't say no, it's not like that, or no, maybe you don't know, or maybe you forgot. No, don't say anything like that. Always use I would like to add to my colleague. Okay, listen carefully to the surveyor, and if they teach something, thank him or her for the information. So sometimes the surveyors would like to add some points or to recommend something. Don't keep tell, oh, that we know this or we are planning or like that, and don't stop them or if they are sharing their knowledge or and experience. So you can just listen carefully to them and then thank them for this information, and just if we are not implementing it in our hospital, just tell them that we are, of course, will consider this and will think about how we are able to implement it in our hospital. Okay, you have always to concentrate on the task you do every day, and don't worry about performing for surveyors. So if you're doing anything like on daily basis, don't be tensed, or like don't fear the presence of the surveyors. If you're doing hand hygiene, if you're doing hand wash, if you're doing hand rub, do it properly, do it same way you're doing every day. Don't like be tensed or stressed, or don't change anything because the surveyors are there. Okay, don't allow them to enter any restricted area without proper precautions. All this, even if there is alarm, if there is a fire alarm, if there is any calls, you have to respond normally like they are a part of our hospital. Okay, always if there is a problem, try to buy a little time. Okay, so that you have to explain to the surveyor, like you may go back to your policies, your procedures, you may check with your supervisor, your head of department, and come back with the required information. We have always like a rule, this rule actually is, we're calling it always the 3 seconds rule. This rule, just if you know the answer, you can initiate or start the answer within 3 seconds. But if you don't know the answer, or if you that they ask the question but you don't know the answer that's about this for this question, so you can ask the surveyor to repeat the question. Okay, and it's your right to ask the surveyor to repeat the question, or like to ask for clarification, or just to make it we didn't get the actual meaning of the question. Or like you can ask for a clarification, just we can say like please sir or please ma'am, that if you can just ask the question in a different way if it's possible. All this is very important. Then after that, if you really don't know and there is no chance to answer this question correctly, then you can redirect the question to someone who can answer, or you can mention this to the head of the department, or you can again tell them that already, like I have to go back to my head of department or my policies and procedures to get the appropriate or the correct answer to you. Okay, so the general tips, and this is the last slide we have, just mistakes can happen. Okay, so but don't lose full control of the situation. Okay, don't lose it. Like if I say something wrong and I know it's wrong, so don't just try to cover it up with a lot of wrong things also, or wrong answers or wrong words. Make sure that you have your answer. If you did a mistake, it's normal. Just you have to go by, you have to control yourself, you have to control your words, you have to control your speech, and just give correct answers. And if you feel you're totally tensed or you're stressed, again you can ask that you will contact the head of the department, or you will go back to your policies and procedures to answer this if it is something not related to your daily routine. Okay, then after that start your answer with we adhere to our policy on the mentioned topic. That means like if I'm asking, if the surveyor coming and asking you, we show me like how you're controlling or how you're auditing the controlled medications. So we have to answer, like we have to start our answer with we adhere to our policy on controlled medications. Then you can answer this question properly. Then if your colleague just mentioned this in the previous like 2 slides, the previous slide is saying something wrong or incomplete, okay, wait for him or her to stop in between, don't cut. Then say I would like to add to my colleague. Don't say oh I would like it was not this way, or like it's no actually we are doing this way. No, you have to always add to your colleague, even if you're saying a totally different thing. Then after that, if there is any incident happen, okay, if there is any incident, be calm and do it normally. You have to contact the concerned or responsible person. If it's something related to safety, if something related to infection control, something related to head of the department, and you have to make an OVR and to do this normally in front of the surveyor without any problem. Okay, so it's again feel normal to say like, and I'll go back to our policy or manual, or and come back to you. It's very, very simple, better than saying something wrong. Inshallah, we hope everything will be fine in this survey, and nothing, inshallah, will be difficult for anyone. And just relax, just be calm, read your policies, you read your procedures, make sure that you checked all these points we mentioned in this presentation, and all the best for everyone, inshallah. Thank you very much.